The Direct Certification List, or DC list, is very important. The more students you are able to provide benefits to through the DC list will help reduce the number of applications needed to be verified. Students on the DC list are not required to be verified. Families on the DC list are not required to complete an application. Students listed on the DC list are automatically eligible for free meal benefits. If one student in the family qualifies because of the DC list, all students in the family qualify for the benefit. Students eligible for benefits because of the DC list must still be notified they qualify for free meals. The DC list is developed by the Department of Health and Human Services, sent to the Department of Education. The data is manipulated and made usable for schools. Department of Education adds the student ID, which is then matched to enrollment data to develop a school district DC list. In order to access the DC list, you must either be a food service director or the legal agent. After logging into NEO, select Reimbursement, then you should be able to see Direct Certification as the second item on the list. Either a printed copy of the DC list or a saved Excel download is required for a review. The upload into MEDIMS or Accountability System software is not the documentation a reviewer will want to see. Once downloaded into Excel, the file can be manipulated to be more effective for your needs. When you access the Direct Certification list, you will only be able to see your school district. The Direct Certification list will be updated weekly. New students will show as new for only that week. If a student drops off the list, they are still able to receive the benefit for the entire school year. The column titled SNAP TANF indicates the type of benefit. S means SNAP, T means TANF, F means foster. If a student has a SNAP number, however they do not show up on your DC list, the student can be searched for. You can search using the first initial, last name, and date of birth. If you find the student, print the report and save the report. The DC list must be accessed at a minimum of 3 times a year. More frequently is recommended. The 3 times a year must be spread out throughout the year, for instance, August, November, and March. More often is recommended. If you have questions, please call the Child Nutrition Office at 624-6843 or 624-6842 and they will direct your call.